Sir, over to you.
Okay.
Okay.
Yes. Okay. Good evening, everyone. Great pleasure to have you all here. I'm Dr. Omkaro, working as a medical advisor at Hetero Healthcare. Our topic of discussion for today is experience sharing program on managing postpartum hemorrhage. Our purpose of today's meeting is to have a better understanding of the management of postpartum hemorrhage and the role of carbetocin in it. Before commencing, I would like to introduce Hetero as an organization to you all. Hetero is serving in the healthcare industry since 25 years. It has more than 300 products in its portfolio and has 21,000 employees globally. It is among the largest manufacturers of ARV, API, and FDFs in the world. It has 36 state of the art manufacturing facilities and has its presence in over 126 countries. It also has Asia's largest API manufacturing facility at Visakhapatnam in Andhra Pradesh. The aims of Hetero include striving to fulfill unmet healthcare needs and reaching to customers across India. It also has wide product range encompassing multiple specialties. Hetero has a distinction of bringing 4 biosimilar products to market within 5 years of initiation. Now, I would like to introduce today's speaker for the meeting, that is Dr. Gopal Chavan sir. Dr. Gopal Chavan sir is currently working as a founder and director of Rainbow's Women's Super Specialty Hospital in Nanded. He has received Lifetime Award from Mahatma Kabir Samta Parishad in 2022. He has done fellowship in infertility from Madhuship Infertility Center in Gujarat. Sir has also worked as an assistant lecturer at Department of OBGY GMC Nanded for 1 year. His areas of interest include hypertensive disorder in pregnancy and high risk pregnancy. So, with this, I welcome you, sir. I welcome all the delegates who have joined and hand over the session to you. Over to you, sir.
Hello.
Hello. Yes, sir.
Yes, I am audible.
You're audible, sir. Yes.
Yes, just good evening to all of you. Myself, Dr. Gopal Chavan. Thanks, Hetero Healthcare, for giving me the opportunity to talk on the carbetocin and area. My areas of interest is postpartum hemorrhage. I will just like to introduce the what is postpartum hemorrhage. Postpartum hemorrhage is a uh, any form of bleeding after the delivery of the baby till preperium, which directly affects the general condition of the patient. General condition means where her vitals is where her vitals, there is pulse rate, tachycardia, and her blood pressure was is lower. Then you can suspect the postpartum hemorrhage. Postpartum hemorrhage may be a primary or secondary. In amount of quantity of loss of blood is in any amount of blood loss more than 500 cc in normal delivery and more than 1 liter in cesarean section, it's considered as a postpartum hemorrhage. Postpartum hemorrhage is more common and can occur even in women who are not risk at risk high risk pregnancy. It is the leading cause of the maternal mortality in low-income countries and the primary cause of nearly quarter of all maternal deaths globally. It is very unfortunate to say that maternal mortality is in India. It was in developing countries. It was 240 per thousand per lakh live births compared to 16 in developed country. Globally, 14 million women suffer from postpartum hemorrhage, and incidence of postpartum hemorrhage globally is around 2 to 4 percent after vaginal birth and 5 to 6% after cesarean section. In India, 38% of maternal deaths are due to the postpartum hemorrhage, and in overall, 25.7% of global deaths take place in India, and two-thirds of this attribute to the postpartum hemorrhage. India has unexpectedly high maternal death rates of 540 per lakh live births. What are the etiology of the postpartum hemorrhage? Uh, Four T's are very important for the cause of the postpartum hemorrhage. First one is the tone of the uterus. Second is a trauma in the genital organs, or and third is a tissue, and fourth is a thrombin. tone is the foremost cause, primary cause. Atonicity of uterus is a main cause for the postpartum hemorrhage. In this, the inability to the uterus to contract and retract inefficiently, leading to the postpartum hemorrhage. What are the causative factors? What are the predisposing factors for the atonicity of the uterus? Are the main factors is the multiparity, big size uterus, or pregnancy-induced hypertension, or multiple pregnancy, or transverse law, or any previous cesarean sections, or a, and second is a trauma. Uterine, is there any trauma, or is there any uterine rupture, or uterine inversion, uterine or retained product of conceptions? And third is the retention of any placental clots or abnormal placenta. And fourth is any coagulation factor deficiency or coagulopathies for thrombin. These are the very four most common cause for the. These are the most very most common cause for the PPH. What are the clinical findings in PPH? In PPH, there is abnormal abdominal tenderness. You can see the high rigidity and guardity of the abdomen, then circulatory collapse in the form of the maternal tachycardia and hypotension, then increased abdominal girth, then loss of uterine contraction. You can see the tone of the uterus, and then the vaginal bleeding. Vaginal bleeding may be concealed or revealed. In mild moderate, you can clinically you can differentiate into mild, moderate, and severe PPH. When there is a blood loss is around less than 1 liter, it is more 1 to 1.5 liter, it is considered as mild PPH. When it is in the range of 1.5 to 2 liter, it is considered as a moderate PPH. And when blood loss is more than 2 liter, it is considered as a severe postpartum hemorrhage. In severe postpartum hemorrhage, there is a blood pressure change, is a profuse fall in the blood systolic blood pressure. It is around 50 to 70 of mercury. And what symptoms in the mild PPH is the weakness, sweating, tachycardia. In moderate, there is a restlessness, pallor, oliguria, and these may land up in the anuria, and collapse, air hunger are seen in the severe postpartum hemorrhage. How will you diagnose the postpartum hemorrhage is a very crucial stage and important stage for management of the PPH. You can just evaluate you should initially evaluate the patient. First of all, you have assess the patient station, general status of the patient. Is there any tachycardia and hypotension, and assessment of vital signs and blood loss? You can examine the entire genital tract. You can explore the vagina, cervix, and vaginal. Is there any tear, laceration, or trauma and hematoma? You can you can manually examine the retained placental. Is there any retained placental beads or tissue inside the uterus? You can assess the bedside ultrasound to check if the uterus is not contracted. You can also you can see for the involution of the uterus. Meanwhile, you can send the complete routine blood investigation, that is CBC, blood grouping, liver function test, RFT, and coagulation factor studies.
Sorry,
Yeah,
whenever you want the next slide, just let me know. I will immediately switch.
yeah.
Sir, whenever you require the next slide, just let me know. I will immediately switch then
Uh,
to the next slide.
okay. I will follow the slides paper. You just wait. Huh?
Okay, yes, yes.
I will control. I will control. Huh?
Okay,
Uh.
yes, yes.
How is the approach towards the postpartum hemorrhage? You can see the clinical findings in the you can judge the abdominal palpitation. You have to see the tone of the uterus. You should uh, ask for the you should do the per abdominal examination, see the uterine fundus. You can set blood investigations. You can set routine ultrasound. You can do the cervical examinations, and blood investigations and reports, regular blood pictures. Then nowadays, what is the rationale for the development of carbetocin in the new heat stable fermentation? Many of the times, maternal mortalities are in the peripheral area or tribal area in India. So, where major problem is the electricity, you can routinely use the oxytocin since last decades for the postpartum hemorrhage, but recently the carbetocin is available. Drawback of the oxytocin is you have to maintain the room temperature. You can keep the oxytocin at 2 to 8 degrees Celsius, which is not very well maintained the temperature due to pharmacies, infrastructure, and staffs. All these are not affordable to maintain the temperature. Here, carbetocin is stable at the room temperature. So, beneficial need for the refrigeration is not required for the oxytocin. Carbetocin, oxytocin, and derivative alkaloids, that is methyl ergometry, that is methergine, should be kept in the refrigerator to avoid the degradation. Heat stable formulation of oxytocin is currently not available. Previous formulation of carbetocin also should be stored between 2 to 8 degrees Celsius. Resources are poor countries do not always have the cold chain transport to maintain the temperature of the oxytocin and storage capability. In compared to this, newer carbetocin is stable at room temperature. Her has self half life of 24 months of at 30 degrees Celsius at 70% of humidity. It avoids needs for the cold chain storage and logistic and it is provided in a vial. This is the major advantage of the uh, carbetocin over oxytocin is there is no need of refrigerator and there is no need of maintenance of cold chain. Use of many uterotonic drugs are available in the market. There is oxytocin, carbetocin, methyl ergometrin, symptometrin, misoprostol, PG, F2 alpha. But what is the ideal time of the administration of the drug? At the time of it may be at the crowning of the baby's head, at the delivery of the anterior shoulder, or at that second stage of labor and following delivery of the placenta. It may be used in the prevention of the postpartum hemorrhage or active management of third stage of labor. What is therapeutic is the management of postpartum hemorrhage. What is carbetocin? Carbetocin is the next generation drug from the postpartum hemorrhage. It is a synthetic, long-acting analog of oxytocin. It is therapeutic use. It is used for the prevention of the postpartum hemorrhage due to the uterine uh, atony. Oxytocin was created by making several modifications to the oxytocin structure. It prolongs the half-life. It reduces the enzymatic degradation. One vial contains 100 microgram of carbetocin in 1 ml solution for injection. It its mechanism of action is it directly acts on the receptor binding, triggers activation of phospholipase C and generation of the second messengers IP3 and diacylglycerol. IP3 induces the release of free calcium from the intracellular stores. It binding of calcium to calmodulin stimulates uterine smooth muscles to contract by activation of myosin light chain kaisen. A single intravenous dose of carbetocin 100 microgram administered after the delivery of the baby is sufficient to maintain the adequate uterine contraction by preventing uterine atony and excessive bleeding with efficacy compared to hours of oxytocin infusion. Clinical evidence, efficacy and safety of carbetocin versus oxytocin. Carbetocin, now it is non-inferior to oxytocin by WHO champion trial. Carbetocin decreases need for uterotonic agent versus oxytocin. It is a single dose carbetocin. Main differentiate between oxytocin and carbetocin is a Oxytocin is a synthetic cyclic peptide form of the naturally occurring posterior pituitary hormone, and carbetocin is a long-acting synthetic analog of oxytocin with agonist properties. Onset of action for oxytocin, it is IV, almost immediate action with peak concentration after 30 minutes. Compared to the oxytocin, carbetocin has IV sustained uterine contraction within 2 minutes, with lasting for about 6 minutes and followed by rhythmic contraction for 60 mg. Its half-life of oxytocin is 1 to 6 minutes compared to carbetocin. Carbetocin is a half-life of around 40 minutes. For oxytocin, you can requires protection from light and storage at 2 to 8 degrees Celsius continuously to preserve the activity. And while carbetocin is stored up to 30 degrees Celsius. Disadvantage of carbetocin is not used for the induction or augmentation of labor. The main use for carbetocin is to prevent the postpartum hemorrhage. Various clinical trial, WHO champion trial, and all these WHO trial decides that there is a non-inferiority double-blind randomized trial to compare the effectiveness and safety of investigation head-stable carbetocin to oxytocin in the prevention of postpartum hemorrhage after the vaginal birth. Hello. Then frequency of blood loss at least 500 ml, zero point 0.5 liter of or more blood loss for the use of uterotonic agent was proven to be non-inferior versus oxytocin. The while you can whenever you can use the carbetocin, there is no need of additional uterotonic drugs are required as compared to using the oxytocin. Conclusion is carbetocin was non-inferior to oxytocin for the prevention of blood loss of at least 500 ml or the use of additional uterotonic agents. In Cochrane review that carbetocin for preventing the postpartum hemorrhage. In this Cochrane review data from 11 studies involving 2,635 women were included. In this, author concluded that for women who undergo cesarean section, carbetocin resulted in statistically significant reduction in the need of therapeutic uterotonics compared to the oxytocin. Also, carbetocin is associated with the less blood loss compared to symptometry in the prevention of PPH for women who have vaginal deliveries and is associated with significantly few adverse effects. Various guidelines recognize the benefits of carbetocin for preventing the uterine atony. WHO in 2018 recommends the use of oxytocin, carbetocin, misoprostol. Any of the drugs can be used. SOGC Canada in 2019 recommends the carbetocin 100 mg IV bolus, microgram bolus. FIGO recommend carbetocin is one of the recommendations for PPH management. Germany, Austria, and Swiss body also recommends the carbetocin 100 microgram IV slowly is for the use of the guidelines for the PPH prophylaxis. My experience with carbetocin is a smarter, superior, and safer choice in the postpartum hemorrhage. In normal delivery, in normal delivery patient, we are using since last 1.5 years that carbetocin was found to be superior to oxytocin compared to showing to statistically significant reduction in postpartum hemorrhage incidence and decreased need for additional uterotonic drug. Because of its simplified and heat-stable formulation, it is very effective for the management of the postpartum hemorrhage. Next. Also, in cesarean section for high-risk patients, that is preeclampsia, big size babies, polyhydramnias, multiple pregnancies, transverse lie, previous cesarean sections, who undergoes cesarean section, previous one or two. In this case, very effective control in the postpart PPH for using the by using the carbetocin compared to the oxytocin. Carbetocin results is carbetocin significantly reduce the need for additional uterotonic drugs. While when you my when myself using oxytocin, there is need for more uterotonic drugs like misoprostol and carboprost. It also leads to less intraoperative blood loss and maintain better uterine tone both during and after the surgery. Carbetocin group maintain better hemodynamic stability, expressing fewer blood pressure fluctuation than the oxytocin group. Next. Studies where in high risk pregnancy cases, twin pregnancy during cesarean sections, or any heart disease with pregnancy with heart disease, a study evaluated that carbetocin is very good in as compared to the oxytocin as for the heart disease patients. Next.
Thank you so much, sir, for sharing your valuable insights. It was such a wonderful session.
Okay.
Now we move forward to the next part of our session, that is panel discussion, where will be having frequently asked questions and real world scenarios which arise. So moving to the first question. Sir, considering the use of carbetocin, if we consider the use of carbetocin as a first-line drug to prevent postpartum hemorrhage, so what are the particular advantages or benefit does it offer?
Uh, we are private practitioner, and you in tertiary I am working at tertiary care hospital. Okay, so whenever they I am routinely used as a carbetocin as a first line drug because I cannot take a risk to develop a PPH or any complications of the patients. The main advantage of carbetocin is there is a heat temperature stability. The efficacy of carbetocin is more as compared to oxytocin in my experience.
Okay. Thank you, sir. Moving to the next question, sir, what are the patient profiles you consider where you anticipate postpartum hemorrhage?
In patient with anemia, patient with big size baby, patient with multiple pregnancies, twins or triplets, patients with PIH, patient with polyhydramnia, patient with AIDS, patient with previous one, two cesarean section, patient with previous any my operated case of fibroid or uterine surgeries, patient with uterine anomalies, unicornuate uterus, bicornuate uterus, or patient with transverse flash. In this patient, there is a chances of postpartum hemorrhage. So you can definitely recommend the use of carbetocin in this patient.
Okay. Means the cases that you explained, sir, scenarios which you explained, in those cases, carbetocin can be used as a first line agent then.
Yes. Any
Okay.
patient with high risk pregnancy, you can. I am using as a first line drug as carbetocin compared to oxytocin.
Okay. Thank you, sir. Moving to the next question. Sir, so generally use of oxytocin is considered for labor induction. So in such scenario, can a doctor use carbetocin for
Yes,
prevention of
definitely.
postpartum?
Definitely. Carbetocin, I am routinely using as a oxytocin for induction of labor and for prevention of PPH. I am using since last 1.5 years as carbetocin for the prevention of postpartum hemorrhage.
Okay. Thank you, sir. So, sir, in which cases would you prefer IV route or IM? So, as generally IV route is preferred if we
IV route
modify.
is IV route is preferable. I am using as a 100 microgram IV in diluted in 10 ml of NS with slowly for 10 minutes, 4 to 6.
Okay. Are there any cases or scenarios, sir, in which IM route can be preferred over IV route?
No. There is no.
Okay. Moving to the next question. Sir, considering the safety and tolerability of the carbetocin, so
Sa-
if given in patient, how well is it
No, no.
tolerated?
Till date, I am using since last 18 months as carbetocin as a first line of drug in for management of PPH. Till date, there is no documentary evidence and no any side effects of the carbetocin we have seen till date.
Okay, okay. Means
The
we can
tolerance
say
of
that
it
the
is good,
safety is good.
good, good.
Okay. So, sir, if the patient is not responding adequately to carbetocin, then in order of preference, which additional uterotonics would you use?
In these cases, you can use the carboprost injections, misoprostol, and methyl ligometry because methyl ligometry is act directly on the lower segment of the uterus.
Okay, okay, yes. Okay, thank you, sir. Sir, considering the advantages of carbetocin and over other uterotonics, so what specific advantages does it offer over other uterotonics?
Advantage of other is action. It is long lasting action. First of all, then single dose preparations, and third is temperature maintenance. Cold, no, there is no need of cold chain maintenance.
Okay, okay. Means there is the need for cold chain, which is not there, we can say is one of the major factor for carbetocin.
Okay. Yes. Yes.
Moving to the next question, sir. So should carbetocin be kept as a reserve drug or should it be
No,
used as
no.
a
It
first
should
line?
be used as a first line drug for patient as for postpartum hemorrhage.
Okay, okay. So, sir, coming to our last question. So, if you have to summarize and in brief, if you have to guide our delegates regarding the overall experience of carbetocin, its efficacy and safety, so what would you comment?
Uh, ca- Carbetocin, you can say as a first line drug for prevention of the postpartum hemorrhage. You should routinely use as a and first as a first choice drug for the PPH, and there is no side effects or any patient's complaints regarding the tolerance of the drugs. So you can definitely recommend as a first line drug for the PPH.
Okay, okay.
Thank you.
So, thank you so much, sir, for sharing your valuable insights and guiding all the delegates regarding where can be carbetocin can be used, what are its advantages, its efficacy, its safety, and whether it can be used as a first line agent. So, thank you so much. I would also like to thank all the delegates who have joined into the meeting and thanks for their active engagement and participation as well. So, this brings us to our end of our meeting. So thank you so much, sir.
Yeah.
This marks the end of our
Thank you.
meeting.
Thank you.
And yes, we can close the meeting now.